So this was on yesterday on Epic Times. It's important to listen to it if you can. I don't know if you need the subscription for it. But this was Dr. David Bell, Public Health is Moving Toward International Fascism. It is, and it's how it's doing it is bringing it on the heels of we can never fix COVID because COVID is the ongoing crisis that they want to continue. This is why it's like we're in, you know, at the way past the half of 3 years of COVID, okay? And they still don't seem to have it under control. Are these experts? No. But it's not about an expertise here. It's about money. That's what it's about. That's what COVID was about as well. This man worked at Public Health. So, yeah, he said Public Health, he even did a peer-reviewed on it. Public Health is moving toward international fascism. Yes, because it's all part of the global agenda. So he said people are thinking COVID has gone away and we're getting back to normal, but in a sort of international public health world, that's not the case at all. No, it's not. We're building new institutions, we're expanding institutions, and all the expansion is around pandemic preparedness and response. Yes, have the ever continuing fear-mongering to the public, the ever continuing, oh, we have this virus, because they saw how well they could control people in 2020. So this Dr. Bell is a public health physician and Brownstone Institute fellow, a former World Health Organization medical officer. He recently published Pandemic Preparedness and the Road to International Fascism in the American Journal of Economics and Sociology. The hope of writing the paper, and I think of us talking, is to try to get the public health world, who are very much on board with this and going forward with it, of stepping back and really thinking what they're doing, because they're repeating things that they know didn't work in the past, and it's clear that they're on that path towards fascism. He argues the public health played a large role in justifying the takeover of populations by colonial empires of Europe, and that given new international health regulations, which will have force under international law, it is likely that history may repeat itself. Forerunners to the World Health Organization were the Paris agreements and other agreements of the late 19th century around stopping pandemics coming from colonies of Europe. So, yes, this is why, this is really important because I've said before how in 2020, all of the Chicago hospitals and surrounding areas, they all put a letter, they all signed it together. I mean, it was 2 pages worth of hospital names. I'm sure they did it in other cities or other states, that said the new public health crisis is systemic racism. We stand with BLM. Then you had some others come out and all do the same thing, maybe a little bit later, but they all worked in lockstep, very much like eugenics does. So Francis Collins, NIH director, apologizes for structural racism, pledges actions. Activists fault agency for not directly addressing funding disparities for black researchers. Human geneticists apologize for past involvement in eugenic scientific racism. American Society of Human Genetics plans to redress past harms and strengthen diversity initiatives. This was this year, January 2023. Top global foundations mount effort to confront legacies of eugenics. Health inequity and racism affects patients and healthcare workers alike. In 2021, University of Washington launches Center for Anti-Racism in Nursing. So here's what I want to say in light of all of this, is that so these people, the nursing profession, the medical profession, even the psychiatric, the psychology associations, unfortunately, I again, this lack of insight is really sick. So the American Psychology Association, apology to people of color for APA's role in promoting, perpetuating, and failing to challenge racism, racial discrimination, and human hierarchy in the United States. Resolution adopted by the APA Council of Representatives on October 29, 2021. So they all did this. The nursing, the medicine, the science, the hospital associations, the CDC, public health, along with like what Dr. Bell said, my first slide in this series, where he said, you know, he came from public health and the World Health Organization. It's all in step. It's very much what eugenics does. Because eugenics is racist, and who it's racist at is humanity. What's really sick about this, and sick because the people that are admitting they're racist or that their organization was involved in racism in the past, they want to be the ones that come forward and control everybody and tell you how it's going to be. They want to ration medication. Now, nursing and medicine would say that's not true, but there's already been instances of it being true. They will just implement it more if people don't speak up against this. The very people, all of the hospitals, all of the universities, all of the nursing and medical professions, psychology professions, psychiatric associations shouldn't be deciding how to move forward. The rest, that everybody should move forward just because they admit their racist past. Now, clearly, it's just an agenda to push everybody into their globalist agenda, which is what Dr. Bell talked about. And again, he would know. Look up his peer-reviewed paper on it. He is surprised they published it. But the people that have admitted that they're racist, that their organization has gone all these years being racist, and personally, I'm just going to say, I've never seen, in the 12 years I've been a psych nurse, anybody, not at the beds, I've not seen anybody, nobody has time for that really. But apparently the people that are running nursing, that are running healthcare, that are running the medical profession, science, all of it, they apparently do have time to be racist and have sat down and thought about how the rest of us are racist, not having any insight into themselves, and realize, no, we're not the racist ones, you guys are. And I don't think the very people that have come out and admitted that they're racist and they say we're going to change our racist ways are the people that really you should trust to then fix the problem. This is part of the problem that we have, isn't it? It's the inability of these organizations, institutions, and associations to take real responsibility. So if their associations were always involved in eugenics and racism, then really, if they truly, and I'm saying this as a psych nurse, this is just common sense, that if you're truly remorseful for your racist ways, then you don't set down a path where everybody has to do this diversity. You don't make everybody become racist with you. You don't decide that because you're racist, because the Nursing Association admitted their racism, because the Medical Association, Psychiatric Association admitted their racism, that it means everybody else is racist. No, it means that you are. And yet you guys are saying that you want to decide, and you're all going along with the diversity, equity, and inclusion, just the way eugenics works. Yeah, and eugenics is racist at humanity. That's who it hurts. It doesn't care about skin color. It will use skin color, just like Karl Marx does, to advance whatever agenda it can. It's a destruction model. So I haven't seen eugenics being used, not in the face of how they're doing it now, not in my everyday, work in the past 12 years, but now I do. Yeah, I don't trust the medical profession. And it's because of the racists that are running nursing, medicine, the hospitals, science, the psychiatric associations. That's why. They're the racist, not the rest of us.